you do the,
I'll call to order. In place of the chairman, vice chair calls this meeting to order, the Community Development Advisory Board. Roll call can be taken by those of us present. First order of business is approval of the minutes from the September meeting. Has everyone had an opportunity to read through the minutes? Any additions or corrections? Do I have a motion to approve? Okay, I have a motion and a second to approve. All in favor say aye.
Aye.
Pose same sign. Motion carries.
hang on just a second, let's make sure she got all that. You good? Okay, alrighty. I love that.
That's all right. Sometimes I need to be slowed down a little. Okay, this brings us to our next item on the agenda, the public hearing number 1 for the Community Development, or CDBG. Unmet, here we go, Chairman.
Yay!
Which is the Community Development Block Grant.
Yeah, block grant, I know,
Yeah.
I got distracted when Charles was doing. First item is the unmet public needs to be addressed with CDBG funds. Is there anyone in, I can now turn this, are you ready to take over?
No, go ahead.
Okay. Is there anyone in the audience that would like?
Wants to address that? Okay.
Okay,
Miss, I think they don't understand what you're saying.
okay.
Okay, yes.
Could you give me clarification?
Yeah.
Well, most everyone else here is a public service agency that has previously filled out this application. And if you haven't, if you represent a group that, okay, would you like to step up to the podium and introduce
Well,
yourself? Go ahead.
I think what she's asking is, for Community Development Block Grant, we need to allow the public or anyone who wants to step forward and speak about how we should spend our funds, the opportunity to speak. And then we will do the public service agencies. So if you want to speak to something other than what's in your application, you're more than welcome to, if you have an area that you think that needs to be addressed. No?
Okay.
Okay. I thought I
It's
just needed
confusing to all of us our first time.
I just thought I needed to clarify that.
Okay.
Okay.
Well, it was a face I didn't recognize.
Yeah, I understand. I understand.
Okay, then if there's no one here for the unmet public need, we'll close that section of the public hearing and open the public service agency funding. And I believe Ms. Trier has a unique and exciting way of who gets to volunteer first.
Okay, well, last year we went from the bottom up, and the year before we went from the top down, so I'm gonna split the difference and kind of start in the middle.
And
So
we
I'll,
just had another new person that I do not recognize.
hi, Bess. So, I will start with, let's see. We'll start at the bottom, and we'll pull one, and then we'll pull one from the top. So, the Leavenworth Mission, if someone from the mission would like to come and speak. Okay.
Hello, everyone. I'm Iris Arnold from the Leavenworth Mission Food Pantry. Last year, we were truly grateful for the funding received to assist us with utility payments because it relieved us to focus on fundraising for the completion of our roof project. In 2019, we had a huge challenge because of our concrete roof that covered our food pantry was collapsing and it had to be demolished and rebuilt. But we found creative ways to keep the food pantry services available for our clients. The Leavenworth Mission Food Pantry assists an average of 550 families each month. We supply our clients with sustainable foods, which means every client receives 2 to 3 frozen meats and a variety of food items that help supplement meals for about 2 weeks. Most of our clients meet the guidelines as extremely low-income households. Throughout the year, we are consistently seeking new partnerships so that we can continue to help our low-income community members to receive products, food, and merchandise at no cost. Last year, we connected with a meat distributor, which allowed us to host 2 massive meat giveaways. In a 4-hour span, we supplied over 850 families with 39,000 pounds of meat. In 2018, along with Second Harvest Food Bank, we started a fresh mobile food site at Bob Doherty Park. Since then, we offer this service twice a month at the park. We do that every month, twice a month, and once a month, the food is distributed in the parking lot at the Leavenworth Mission. For those that are unfamiliar, this is a drive-up food service. Community members line up in their vehicles and volunteers place a variety of foods directly into each car. About 250 families receive help from this service each time. We also assist 4 church groups by supplying foods that help to provide a free community meal every 5th Thursday. And we partner with Churches United for Our Youth to provide book bags, toys, and school supplies for their annual back-to-school event. The mission is also a dependable resource for the LHS Junior ROTC program and other groups that need to meet volunteer hours that are mandatory. For the remainder of this year, efforts will be focused on Phase 2 of the Building Fund project, which includes spray foam insulation for a new metal roof. So we thank you in advance for any support you can give. Any questions?
Yes, I'm sorry. Where did you come up, I read your application, where did you come up with 9,000? Why is 9,000 amount requested?
Because the utilities normally runs, I think we have on there about 16,000 for utilities, and the Westar Energy, or whatever it is, Evergy, that's the portion that would be covered.
Okay. And do you have a list for how does the low income meet the criteria? I mean, where do you get that information from?
Right, we have, there's income requirements that are defined by TFAP Foods, which is a federal program, so they have to meet those income guidelines. But we don't designate those guidelines.
Okay. That's all the questions I have.
Okay.
Craig?
Would you like to take over now, Mr. Chairman?
I'm not quite ready.
Okay. Dang, I can't get rid of this. I'm responsible for nothing.
My apologies.
Okay, thank you.
Okay, thank you very much. Next one, the Alliance Against Family Violence.
Hello, Commissioners. My name is Lori Randall. I am the newly hired Executive Director for the Alliance Against Family Violence. Amanda Schiller, she is the case manager for the Alliance. Last year, the Alliance received $10,000 for utilities for the shelter through the CDBG grant. Amanda is going to fill you in with a little bit about the Alliance, the history, some of the services, comprehensive services that the Alliance has been providing for the past year.
Okay, the Alliance provides services to Leavenworth communities and adjoining areas. In addition to confidential shelter, the Alliance provides comprehensive case management, group support programs for both children and adults, sexual assault advocacy, hospital advocacy, police response advocacy, a 24-hour, 7-day crisis hotline, crisis intervention services such as safety planning, community awareness, education efforts, and court advocacy. The Alliance adheres to all standards set forth by the Kansas Coalition Against Sexual and Domestic Violence, as well as the Kansas Attorney General's Office and the Kansas Governor's Grants Program. During 2020, the organization's focus will include continuing connecting with community partners and stakeholders to ensure allied agencies and social services provides working with low-income residents are aware of the Alliance services and capabilities, contact information, intake protocol, and eligibility requirements. The Alliance's community outreach list includes, but is not limited to, area law enforcement, Leavenworth School Districts, CASA, Catholic Charities, City of Leavenworth, St. Vincent Clinic, Trio, St. Mary's, Fort Leavenworth, Interfaith, and detention facilities and area churches. Reported DV incidents in 2018 are as follows. Tonganoxie Police Department was 3%, Lansing Police Department was 8%, Basler Police Department was 3%, Leavenworth County Sheriff's Office was 9%, and Leavenworth Police Department was 77%. And that's all I have. Any questions?
Questions from the board?
Yes, I'm sorry. I don't mean to be. I see in 2017, and you don't have, you can share it or whatever, that the Alliance was closed down for any particular reason. I know it had to be a reason why it was shut down.
It was financial.
Financial?
And then they opened back up 2019, April 1st.
Yeah, Sister Jane got too old to twist arms.
I think, Ralph, if I might speak to that, because I know their director is quite new.
Yes, ma'am, please.
The Alliance had the state of Kansas was about 6 months behind in reimbursing them for expenses. And they got some large grants from the state. So they got caught between expending funds and not being reimbursed for those funds, because many of the state and federal programs are on a reimbursement basis. So it became impossible for them to remain open. So what they did was they shut down and worked with the state agency to reestablish themselves and establish a reserve fund that would be able to see them during those periods of between when they expended the money and when they got reimbursed for that money. And the city of Leavenworth, as well as Leavenworth County, contributed to that reserve fund to be able to help them reopen, because it was a needed service for both the sheriff's department and the police department.
Okay, so with that in mind, what's the percentage of a turnaround for us? What I'm saying is, in the percentage, how many families or whatever have you helped that have came back, or, was actually,
Since April 1st of last year, we've had 58 residential clients. That means in shelter, but we also have non-residential clients as well that help with protection orders and court advocacy, sexual assault, and hospital advocacy. But actually, in the shelter, 58 families from April to December.
Okay. Well, I just read in the report that even the police chief is well needed. It was a 20% high, 20-year high after when it closed down, so, yeah. All right. Thank you.
Thanks.
Yeah. I do have one question, if you wouldn't mind stepping right back up there for just a second. I'm sorry. I was just wondering if you could speak to, and maybe you can or you can't, speak to how that reserve is working for you now? Is that still in place for the Alliance to be able to get their funding from the state?
As far as I know, it is.
Okay.
So, but I don't really deal with the finances, but from what I know, it is, so.
Okay, all right. Just checking. Thank you.
I want to clarify, you're saying to ensure that lag doesn't happen again?
Right. I consider it kind of like a buffer,
Yeah,
you
right,
know?
absolutely.
Like you almost need a dollar buffer.
A savings account,
Yeah.
rainy days.
Yeah, the rainy day fund, because at one point, the state was not real good about reimbursing quickly.
When the executive director left January 8th, I know that we had enough money for about 6 months, so.
And that's exactly what you should have. So that's great. Okay, so, good, thank you.
Ralph, you being new, don't be afraid of asking all the questions to make this understandable. My first year, they throw me this packet of information every meeting, and
I
is
would
it
like-
mind-boggling.
Everyone should ask questions. All right, the next agency up, please, is the Guidance Center.
Hello, I am Rachel Sweet from the Guidance Center. We are the community mental health center in Leavenworth. We serve Atchison and Oskaloosa, Jefferson County as well. But in Leavenworth, we serve clients who are extremely low, very low, and low income. We do have some primary care, some private insurance that we do as well. We serve all clients regardless of their ability to pay, and we offer them the same level of care regardless of their ability to pay. We do outpatient therapy, medication management, case management, attendant care, psychosocial, and we provide transportation to our clients if they're unable to make it to the Guidance Center on their own. We're requesting $6,072.46, which is the cost of one utility bill. December's the big one, but we are on 500 Limit Street, across from Walgreens, a large facility there. And last year we wrote off about $1 million in funds that we were not able to be reimbursed from our self-care or self-pay clients. Any questions? Yes.
I have a question. I know in the past you did have home care services. Did that service stop or for?
Yes, Health Homes. That service did stop, and it's starting again in April. It's going to be already clients that are a part of the 3 Medicare providers, Medicaid providers, so it's not open to everyone. It's only clients who we already see right now, and I'm not sure how long that's going to last.
So that would just be like following up on their care, or maybe medicating them at home, or?
It will be mostly testing for diabetes, doing like blood sugar tests for them, trying to keep them out of the ER, but not actually in-home care, but it's called Health Homes.
There you go.
So,
Okay.
yeah.
Okay, good.
So how do I qualify for the program?
For Health Homes?
Crazy.
No, for just Guidance Center to be able to use
Well, do you have primary, or do you have health insurance?
Yes, I do.
Well, then if we have a provider who accepts your health insurance, you'd be able to come in and see that person. Same day, you can have an intake from one of our emergency or our crisis clinic, and then they would assign you to a therapist. Now, if you didn't have health insurance, exact same process, except we would look at your income, figure out if you're able to pay anything, even if it's $5. If you're not able to pay, then you can still come for services.
Excellent.
What's the difference in, Mary Babelix, what did they request and receive last year? Do we have that?
Last year,
It's on this
Oh, I
sheet.
apologize.
that's okay. Last year, they requested $6,072. No, last year, I don't have their request, but their fund was $3,943. Their request this year is $6,072. I didn't put the cents in there.
Gotcha. Okay.
I like big round numbers. The next agency, please,
Okay,
would
thank
be.
you.
Yes, thank you very much, I'm sorry. My apologies. Leave her hanging, that was bad. Next agency would be Catholic Charities of Northeast Kansas.
Good afternoon. My name's Jackie Masner, and I'm the manager here at the Leavenworth office, Catholic Charities. Thank you for your support in the past, and I think this year we're applying for $5,000. Catholic Charities, we provide a variety of services at our location. We handle the ESG funds, that is the Emergency Solutions Grant, Rapid Rehousing, Homeless Prevention, which basically houses people that are homeless, as well as keeping people in their homes. That pays for rent and utilities and sometimes deposit to get them into a place. We also have emergency assistance with rent and utilities, okay? We offer case management that is stability and strengthening, focusing on their employment and education and budgeting. Catholic Charities at this location, we also do applications for the SNAP, which was former food stamps. A lot of people at the north end of town, there's transportation issues. They can come to our office and we will help them fill that out, okay? We also have clothing, household items. We assist during the holidays with Thanksgiving and Christmas. We have an emergency food pantry that we operate. This is a client choice food pantry. Last year, our averages were about 146 families a month and about 1,400 individuals. For senior citizens, we do the commodity supplemental food program. This is an extra box of food for our seniors, which is a very vulnerable population. We've also got our friendly visitors program there, which is for seniors that live alone. Okay, volunteers will visit. They will also make phone calls, make sure somebody's taking their pills, basically trying to meet some of the senior needs. Currently, we are doing the VITA, the Volunteer Income Tax Assistance Program. Last year, we did 168 returns, and we brought in total refunds, about 170,000 for last year, came back into the community. We also have the Kansas Loan Pool Program, which is a program for people to get out from the payday title loan trap that they sometimes find themselves in. Our new program this year is our Family Financial Transformations. We're partnering with St. Mary University. We're just starting our pilot class, and this is teaching better financial and budgeting skills. And right now, I think that on the first one out, we are full on that class, so this is exciting for us. Volunteers, we utilize about 60 a month through our office, okay? Basically, last year, I think I had about over 8,000 volunteer hours through my office. So we're kind of utilizing all the resources we can in the community. We're trying to put money back into the community, and we're trying to support the community in every way we can. We service low-income families. That's who comes to see us. And thank you for your time.
Any questions from the board?
So it looks like you need some transportation, huh?
Well, like I said, there's not a whole lot of, yeah.
Okay,
So,
I got you.
Transportation would be nice.
Yeah,
Yes.
transportation.
That'd be
Talking
awesome.
about that for a second.
Yeah.
Understand, right?
Yeah, we were talking about transportation.
Yeah.
Okay, well, that's, okay, no, you're fine.
Thank you.
You're welcome.
All right.
If only we knew a school bus driver.
Next-
Only transport kids. No.
Next agency, please, would be St. Vincent Clinic.
Yeah, I don't have a passenger endorsement.
Okay.
Hi there. Hi. Good afternoon. My name is Beth Bonowitz, and I am with St. Vincent Clinic. St. Vincent Clinic here in Leavenworth. We actually provide services for patients who do not have health insurance. We're a primary care facility. We do routine preventative care, acute care. We also treat patients who have chronic diseases such as diabetes, high blood pressure, high cholesterol, depression and anxiety, clotting disorders, and other chronic conditions. We work with University of St. Mary to provide physical therapy. And we've also recently added chiropractic care with the Cleveland University of Kansas City. They have a chiropractor who comes and does chiropractic at our office 2 days a week. We also work with some local providers to do referrals for specialty care such as vision and dental and the Guidance Center for Mental Health. We are asking for, I believe, $13,000 to help with our utilities. A lot of our patients, 20% of our patients who come to our clinic are homeless or unstably housed. We are recently going to start billing for Medicaid and Medicare to add a little bit more sustainability to our clinic. We treat all the patients regardless of their ability to pay. We charge our patients a $15 copay to see a provider and $5 for just a lab. We have not raised our prices since I believe we opened. And we have been around since 1986. We are the only safety net clinic here in Leavenworth County. So we provide primary care to patients in the entire county. And I would say about 50% of our patients come from the city of Leavenworth. Are there questions?
Yes. You mentioned having chiropractic care. Do you have a medical doctor on staff?
We have, our medical director is an MD, and we have a nurse practitioner who is there the bulk of the time. So our medical director is an MD, and she is there 1 day a week, but she also oversees the nurse practitioner who sees the bulk of our patients.
Thank you.
Do you have any comments from staff?
I just had a question. It said in your document you saw 370 clients this year. Is that up or down from what you usually see?
It's a little bit down, but for the most part, it's remained the same. We're about 375, 380, up to 400 right now.
Okay.
We are reaching out to patients who have left us by getting Medicaid or Medicare, and so that will actually add to the amount of patients that we're able to keep on our panels.
When do you start the Medicaid, Medicare?
We plan to start billing this month. I just developed a flyer for our patients who have recently left us.
Okay.
So it'll probably, I know it's going to be during the month of March.
And
It'll
how
have
much of an
effective date.
increase do you think that's going to be for you?
It's slow. We are like not full on advertising that we're taking Medicaid and Medicare. We wanted-
Soft opening. Okay.
There's a lot of administrative back-end things that we have to work out, and we also understand that there's going to be some kinks we have to work out on our own with workflow and patients who have private or have Medicaid and Medicare insurance. We're going to have to work through how we work with those patients a little bit differently and what their options are. And so we have to figure out all those pathways for referrals for those patients. So it's slow, but we are going to start billing this month.
Okay.
Do you still get medications through the Kansas program?
We do. We get medications 3 different ways through the Kansas Unused Medications Act. So it allows, as long as the medications have been secured in a facility behind a locked door, long-term care and acute care facilities can send medications back to a neutral location, and then we can order off of their website a couple of times a month. And it allows our patients to get access to, sometimes it's antibiotics, sometimes it's insulin, it's some medications that allow us to maybe try something before we do a prescription for them. Another way we give medications to patients is through the indigent med programs through the pharmaceutical companies. And we do, I think, like almost $900,000 worth of unused, or of $900,000 worth of medications that get distributed to our patients. Those are the really expensive pharmacy medications like insulin, hypertension medications, statins. Yeah.
Nice.
Other questions?
This is going towards utilities and/or rent, or one?
No, just utilities only.
Okay.
I think our rent is $1 a year.
We can cover that. Thanks for clarifying that. I don't know if I saw it. It might be right in front of me, but I couldn't find it, so I want to make sure.
Thank you, Beth.
Thank you.
The next agency we'd like to hear from is the Leavenworth Interfaith Community of Hope. And they are applying specifically for their Welcome Central portion of their program.
Hi.
Hi.
Alicia, can I just move the microphone for you just a little bit?
Please do.
You and I are
Vertically challenged.
pregnant. The
And
ladies.
very pregnant.
Yes, very pregnant.
Hi, I'm Felicia. Like she already said, I represent the Interfaith Community of Hope, and I am specifically the director of Welcome Central. Welcome Central is our resource hub. Other areas of the Community of Hope include our night shelter and also our day center. So our night shelter is open every night from 9 p.m. to 7 a.m. So we provide a safe place for clients to sleep. And our day center is open until 3 p.m. and that's a safe place for people to just come and be and eat breakfast and lunch there. And then they can come back to Welcome Central if they're needing specific assistance. Some things that we do back in Welcome Central, we provide assistance with getting IDs like birth certificates, social security cards, driver's license, rental and utility assistance, helping pay co-pays on medications. We provide transportation services Monday through Thursday while Welcome Central is open as well. Help with application assistance, whether that's for food stamps or anything else that they might be needing. And we are requesting assistance to help with our utilities as well to free up funds to help more with rental and utility assistance because we can't help everyone, but we'd like to be able to help more, and we do.
Is there any questions?
No
Comments
questions?
from staff?
No, I have no questions.
Thank you.
Thank you. Okay.
Next year it'll be easier.
Yeah. Okay, so the last agency we would like to hear from is the First Judicial District CASA Association.
I've never been last.
I know, that's why I switched things up.
Good job. Hello, my name is Kelly Meyer. I'm the Executive Director for the First Judicial District CASA Association. We have 3 primary programs that we operate in Leavenworth County. We are literally just across the street, catty corner. If you've never had a chance to visit our offices, I welcome you to come over. I'd love to show you around. If I'm not there, I have staff that would be more than happy to show you around. We love showing people our space and telling you about what we do and how we kind of work within the community to make sure that we're servicing the needs of the kiddos. So speaking of kiddos, we are kind of like a one-stop shop for kids services. We have 3 separate programs that we operate. Our namesake program is the CASA program, which we work with children that are in the Child Need of Care court system. They are adjudicated by the court as children in need of care, and then once that occurs, the judge will decide whether or not those children need a CASA advocate. If he does, then we are appointed to those cases, and we train and certify volunteers to then advocate for those children through the life of that case, which averages about 18 months. And so we house in our office the staff that manages all the volunteers throughout that program and the staff that trains all of those volunteers. We also have a space in our office for our volunteers to come and just kind of do what they're doing that's away from their own houses with their own families and their own kids, and a space for them to be able to work on their reports and meet with our staff and attend virtual meetings if necessary. So that's one of our offices. The other is our Child Exchange and Visitation Center. Again, we utilize volunteers heavily in this program. We train them to be visit monitors, and we supervise visitation between a non-custodial parent and the child. That is actually occurring right now. Sunday nights, Monday nights, and Tuesday nights for 4 hours each night. We supervise those visits and make sure that children have a safe place that is neutral between the parties where they can visit with their non-residential parent. We also do exchanges, and on Friday nights we do exchanges for the weekends when parents need to exchange children and they cannot for some reason or another have contact with one another. It was 2 years ago in November, we took over the operation of the Child Advocacy Center. So we perform all forensic interviews for children that are speaking about 3 years old to 18. And so if a child has been the victim of some type of abuse or they have been a witness to a violent crime, we have the staff that do the forensic interviews for those children. We record those interviews, and then that's provided to law enforcement or prosecution, depending on where that case is going. And we provide ongoing advocacy for that child and the non-offending caregiver. So I tell you all that to give you information about what we do across the street. But I also want to point out, I am very aware that our ask is higher than most other agencies. The reason we do that is because we operate a lot of programs and services. We have 3 separate programs that we operate under our umbrella. It's not just one program that we're operating there. And I think sometimes I feel like, gosh, I'm asking for so much money, and I am, and I totally understand the fact that that is what I'm doing. But I want you to understand that it's not because we're being greedy. It is because in other communities, all three of these programs have the ability to work independently and are three separate agencies and entities. We just happen to be taking care of all that business under one roof, and making sure that those services are available through our umbrella agency. Questions?
So what will you need, the amount you requested was 15.5. What were you needing that for again?
We request funds for our rent. It averages, it's a little under 50% of what our rent is for the year. And that is for all 4 of the spaces that we occupy. So we have 4 different suites in our location.
Now, I assume that's a secure location and you just can't walk in there.
No, our doors are locked. At our Child Exchange and Visitation Center, we have a call button where you have to be buzzed in. And all of the other doors, someone has to greet you and actually let you have access to the center.
Okay.
Other questions from the board? No?
Thank you very much.
Thank you.
Thank you.
Okay, our last application is slightly different than the others. It's a request for funds to be used out of our Public Services Agency funds. It's a separate, Interfaith Community of Hope has applied for funds for repair, yes. And for us to do that, it was in our 5-year plan to have funds set aside for those public facilities that serve the entire community. They could apply to us for funds to help with their repairs or changes to their operation that are structural. So this is the first application we've gotten in the 5 years that I've been here. So it's coming in kind of here toward the end. The Interfaith Community of Hope has applied for funding to, well, I'll let them explain what they're planning. I don't know why I'm trying to explain that. Linda, can you come up and talk to them, please? So this is our institutional rehab application, if everybody's looking for that in your pack.
Hi, my name is Linda Martin. I'm the Chief Operating Officer for the Leavenworth Interfaith Community of Hope. I'm here representing Sister Vicki Perkins, our Executive Director. We have applied for institutional rehab funds. You may have noticed our new building at 311 Kiowa, at the corner of 3rd and Kiowa. It serves us well. Felicia talked earlier about the 3 entities that are housed in that building. We serve a diverse population, many of whom are not ready to get a job, they're not ready to get an apartment. We need to work with them in very basic ways. One of the ways we're working with them is a garden. We have 4 raised beds. It was our first year last year, and it was very successful. The guests took care of the beds, harvested the crops, ate the crops, and showed a great deal of development in their social skills as they were doing this. You may think that doesn't have anything to do with our institutional rehab app, but because of this, we need more storage space for garden equipment, lawnmowers, hoses to water the garden. One of the things we're asking for 3 parts in our application: a storage shed for the garden equipment and yard maintenance equipment. The yards will be taken care of by the guests. When we first started the building project, it was seeded and cared for the first year by a volunteer and a donated service. and we're taking over that service now, and the guests are going to provide the work. So we're asking for a 12 by 12 storage shed, a prefab shed like you get at Home Depot. It includes installation. They'll come and set it for us. In the rear of our building, we have a cement patio and a picnic table that's our smoking area and relaxation area for our guests. And on days like today, when it's raining, it's not very pleasant to sit out by the picnic table. So we're asking for new construction of a canopy roof over the patio, funds to complete that project. The third part of the application is the repair of a large pothole in our parking lot. Our parking lot is an interesting story. We were given part of the land where the building sits by the city, was donated to us. We purchased an additional part in order to have enough space to build our 6,000 square foot building. The parking lot is a combination of land that's owned by the Community of Hope and land owned by Riverside Resources. We have an operating agreement with them, and they have endorsed our application for these funds. We're asking for a total of $42,000. The estimates are informal estimates given by local contractors. We have, until we get deeper into the project, we don't have exact figures. But I would thank you for the opportunity to talk to you today and to request these funds. You have any questions I might answer?
Questions from the board at all?
So you're saying that this 42,000 is just it's not actually the actual estimate of it, it's just a guess, you know, tell you, like you said, you get into it, then they're gonna either charge you more or less, or this is the set figure?
It is not a set figure. These are informal estimates by local contractors. It was their best guess.
However, if we award funds, we would award a set figure.
Right, exactly.
So that's how our process would go.
On our 5-year plan, I mean, 42,000 is a pretty good chunk. Are we allotted that, or?
Well,
I can't remember in the 5-year plan.
we did not allocate last year any money into institutional rehab or public facilities. This year, if we choose to award into that category, we can. And in the preliminary budget that I sent to you, I put some funds in that area as a placeholder, not knowing whether you would want to award or not. And there's possibly another agency that's going to consider that funding area, which we would visit during the course of the year. Any other questions for Linda? Otherwise, we could let her leave the podium.
Thank you.
Thank you, Linda. Okay. That is the end of the agency funding
So do we need to
portions.
close this portion of the public hearing?
Correct.
Okay, let's close. If there are no objections, we'll close this portion of the public hearing. And thank you for your contributions and continue to help serve the community.
Have a great
Thank
day,
you.
ladies.
All right.
Thank you.
Now, do you want to take over?
Sure, I can take over. I don't know
We're
what
down to
it's
step 4.
So do we have to move to close the hearing or no?
Yes.
Okay.
Oh, I'm sorry.
Move to close the public hearing, please.
I'm sorry. Do I have a motion to close the public hearing?
I move to close the public hearing.
Is there a second?
A second.
Motion is second to close the public hearing. All in favor say aye.
Aye.
All opposed, same sign. Motion carries.
Okay.
Yeah, that's one always open to close the public hearing.
Gotcha.
They get upset.
Yeah. Okay. Does anybody have any other matters or correspondence? The staff does not.
Nope, I apologize for being a few minutes late.
That's all right.
This weather.
Blame it on the weather.
Yeah.
Well, between the weather and the hour late,
That's
Yeah.
somebody
an
stole,
hour earlier.
somebody stole an hour from me yesterday, and I'm
Yeah.
not happy about it.
Okay, so following the public meeting, I wanted us to have a brief and frank conversation about the annual action plan funding, what direction you would like to go with the public service agency funding, and then that institutional rehab funding. So I think in your packet, there is a synopsis of the funding, the annual action plan. Why don't we start with that? Just to let you know where we are. I planned this year's annual action plan based on the monies that we were awarded, which is $342,514, and a projected remaining funds of $200,000. That's been accumulating over the last 4 years, which gives us $542,514. Of that, I set aside as limited by HUD, 20% for administration and 15% for public service agencies. They limit those two amounts. Then the rest of the money I dispersed primarily for home repair, because that's where we have the biggest request. First-time home buyers program was the next category. I'm saying a lot today. Sorry about that. Removal of dangerous structures is also limited by a little bit more complicated formula by the federal government. We are allowed to award up to 30% of the money, 30% of the money that's being spent not in administration. So that came out to $60,000. And then for that institutional rehab, which is also called public facilities, I set aside $70,000, not knowing how much the Interfaith Community of Hope was going to ask for, and if there was going to be another application from another agency.
So, if I understood it correctly, you said that there's another agency that we think is going to request.
I do.
Okay.
I don't know if that's going to happen. I can just present the information to them, and that I have to say that the sticking point with using the institutional rehab or public facility dollars is that you have to go with Davis-Bacon wages, and you have to monitor, according to the federal government, those Davis-Bacon guidelines, which is, it means that, one, you're going to pay more for labor in a town our size, because you're going to pay prevailing wages. And the second thing is that you have to have somebody that's willing to monitor those things, because even though I will monitor after they monitor, they are ultimately responsible for that monitoring. So it does present, I understand with agencies that are smaller, that it is much more complicated to try and do that. So I respect them taking time to think about it. How's that?
So if the interfaith, when they're asking for the money, so then if they get some or all of the grant, then they have to go by those guidelines, and they can't.
Yes, they do.
Federal standard.
Federal standards, so.
Yes, they do.
In a way, can be twice as much, I mean.
I don't believe that it'll be twice as much, but it will be more. for some of the things that they're looking at doing. For some of the things, it might not be more because we're close to a metro area and sometimes they already pay those wages that are comparable to prevailing wage. So, but it might be a little bit
But they
more.
do the hiring and everything, the contract?
Yes,
Okay.
yes, they're responsible for all parts of their project. Does anybody have any questions on the annual action plan? Anything that you think needs to be re-evaluated?
On the first-time, I mean, how are we doing on first-time home buyers and repair program? Are we?
You know,
I know it ebbs and flows.
It ebbs and flows, and right now, I think I've done 14 home repair projects, which is down a little bit from last year, because last year I did 25. I'm hoping I'm gonna catch up some here in the spring, but, I've got an appointment to go talk at the Council on Aging. We've been putting things out with public service agencies, try and get the word out. Quite frankly, I don't know why people don't apply. You can only know why they do apply, but you can't ever know why they don't apply. But it seems like if you have a big year like last year, then you have a smaller year this year, and it might just be kind of the way it goes. But, and then homeownership, it's not real fair to judge it yet because the big
spring buying season.
Spring buying season is the big market. So I've already sent out information we've done 4, and I've got 1 more to close, so that'll be 5, I do believe, 4 or 5. And so I've sent information out to a lot of the realtors and real estate professionals that I work with. I've also sent it out to banks and title companies so that everybody in the process knows that we have the funds available if they have somebody that's a first-time buyer. So hopefully we'll get some more. I'd really like to see that get up higher. It's a great program. It's instant equity. I'd really like to see it pick up, but it's getting the word out. It's all about the word. So that's kind of where we are at this point. If no one has any suggestions or questions on that.
I mean, one thing we've done in the past on the institutional rehab is we like the group at that time, board at that time, like to see the presenting group have some skin in the game. Instead of doing 100% finance, we do 100% of the cost.
Yeah, we talked about that in the past. And I think the application, if I'm not, I think the application requests that they have a portion. It's not on this cover sheet, but I'd have to go back and find that.
Because they're requesting 42,000.
Yeah, straight up.
And then on their cost projection,
It's
it was
42.
42,000.
Right.
Oh, we're
That-
saying we want them to foot some of the bill and not, gotcha.
Be totally reliant on us funding it. That is a characteristic I always liked.
How does the rest of the board feel about that?
Oh, I'm fine with that. Hey, I agree with him, yeah.
I-
That way, they'd be responsible, you know what I mean? And maybe they find somebody, reasonable, whatever, so I'm all for it, yeah.
Okay.
So no matter how much we give them, we still have to go with that contract, right?
We have
And
to
like
go
they-
with the federal.
But with the federal guidelines, yeah.
Unless it's under $2,000.
Oh.
The chances of that are impossibly
Yeah.
slim.
Impossible.
Impossibly slim.
Uh-huh.
So would the board like to see that reevaluated so that they have some percentage of the project? $25%?
20, 25. I think it was 20%
At
in
least
the
20%,
past.
yeah, at least 20%.
Okay.
I'll volunteer up there, so I know.
Is that gonna change what they request on, as far as the other portion?
Those are two separate
Oh, okay, yeah, never mind.
tickets.
Yeah.
Sorry, making notes.
That's fine. And if
So
we got
what was their request again there
42,000 total
for
for a shed.
shed?
Parking lot
Parking lot repair, shed,
and
then
a
the-
canopy over the smoking center, smoking table,
Their patio area.
patio area.
High dollar.
Well, I'm kind of, my bias, I don't think they need, I'd like a patio cover too, but
Well, I understand that, but I do, they have to provide someplace for people
Yeah.
who smoke
Yeah, it's,
outside of the building, so
Right.
whether they do that or they buy a separate shelter, they're
Yeah.
still gonna end up, I think, paying some funds. And the
So-
police want it to be something open,
well, so you can
Right.
see in.
so you can
you
see in.
see,
And we're not in the business of telling them how to go about that, we're in the business of,
right.
Deciding whether or not we
Yeah,
wanna do
funding or
that.
not.
So I would go back to them and ask them about providing 20% of their own funds into that, and then come back to the board next month with the follow-up on that. Does that work?
20% of that, real quick, does anybody have?
It'd be
$8,000.
$8,400.
Okay, yeah. I'm doing, yeah, that's about right.
That's the next- aren't you a math
I'm
teacher?
second grade teacher. No, I'm not into, but I can do.
I have a phone that does all that for me, so you'll excuse me.
You have an assistant?
Yeah.
Okay.
That's reasonable.
So the annual action plan, we're going to leave as is. Public Service Agency is the next piece that we need to decide. What I did was I prepared for you a spreadsheet that had the rank orderings according to your, I aggregated all of your scores and then came up with an agency score. Then I tried to rank those scores, although two of them came out as number one. And then I tried to give you some information about each of those agencies. Then I pulled off of their sheets the number of individuals served, the amount requested in 1920, or the amount funded, not the amount
Right.
requested. The amount funded in 1920, the amount requested in 2021, which is the year we're working toward, their overall budget, and the percentage that the CDBG request is of their overall budget. And then I gave two scenarios for funding them, though we can choose any scenario that you would like. It can be one of these two, it can be something, a hybrid or something creative. It doesn't have to be systematic or logical. What I did with proposed funding number one is a straight 7% increase for everyone down the line. The funding proposal number two, I weighted it for the top scores. So the bottom scores, which would be number 5 and 6, I left them at last year's funding. The Community of Hope, I gave them what they requested because it was less than last year's funding. And then the others, I gave a little bit more, according to a percentage. So I'd entertain some discussion about funding and some direction on how to go with that.
I mean, if we're gonna do the weighing of the score, or if we're gonna top to bottom score them, I feel like they should be
We actually
rewarded
already
for
did.
that, based on,
Well, that's what she
Instead
did.
of the straight 7%, yeah, I think.
Have we heard anything of what our funding's gonna be like for next year?
Yeah, next year, we're getting $342,514.
So that's the 7% more?
That's
Plus the-
7% more than we got this
Okay.
year. That's where the 7% came from. I should
Plus
have
the
explained it that.
200,000 that we had left over.
Well, we can't
use it.
can't award that because, we can't award that for public service agencies. We,
Hands are tied.
yeah, we're only allowed to do 15% of the current funds toward either to public service agencies, 15% of the current funds.
And a certain percentage of that has to be used for things within, that doesn't reflect that 7%.
It,
I want to make sure I understand. So-
okay, so the $342,514 is 7% more than last year.
Got it, okay. That's
So,
where the 7% came from.
so the public service agencies can receive 7% more. So with that 7% more, you can either do it just 7% for everyone, or you can take it and you can give more to one agency and less to another agency. So in proposed funding number 1, I just gave a straight 7% increase to everyone. Funding proposal number 2, I waited and gave more money to the top scores, and then the bottom ones I gave, the bottom 4, I think, I gave exactly what they got last year.
Sounds good to me.
As a different way to
Yeah,
do
I know,
things.
this is always a tough one.
I know it is, but it's something you guys have to do.
See, all of them are, I mean,
We're not deciding this
all of
today,
them
are
are
we?
needed.
Or we are?
All of them are needed, but I mean, just 7% for the, funding to 1 and then 2, I'm like this, they're getting something. So, I mean, they, in other words, they had more than what they did before they started, so.
Yeah. So are you thinking you want to go with 7% for all of them?
Yes,
Is that
ma'am.
what you're saying?
I'm thinking 7% for all of, I mean, that's just me. I'm thinking 7%
Okay.
for all of them across the board.
Bobby, what are you thinking?
Now, I could be swayed to the other side now, so.
Absolutely.
Oh,
But I think it's good
I'm
for people
very
to state their
flexible with
opinion.
this, yeah.
I'm just curious, looking at this when I was looking at this at home, how the ones that came on top served fewer people. St. Vincent, 215, CASA, 473.
Well,
And I was just wondering what the rationale
And-
was, the
and-
thinking behind.
I think that I can't really speak to how you scored, each person scored their applications. You guys can talk about that, but I don't think by looking at this, it wasn't based on number of people served. It might have been, I mean, it's very hard to compare these apples to apples. Because some of them serve people quickly, and like, some of them, like St. Vincent Clinic, they see them on a regular basis, okay? So maybe every month, maybe every week for some of the people that are diabetic. So, food pantries, they see them quicker than people, so they have a higher number than, say, CASA, which sees them on a weekly basis. So, I don't know.
I looked at that too, and when I looked at, like the mission and like Catholic Charities, a lot of they're pretty instant. You show up at their door and they're gonna take care of you. And you may be needing food today, maybe you just need a little bit of rent or water money or whatever. And the other facilities, like Vincent's and CASA, CASA too, they're more of a medical entity, and their services are based on need, but ongoing. They're not just terminated. You don't get to come in one day and then we never see you again.
And the question I
And most
forgot.
of the services of the other places, like the food pantries, a lot of their foods are donated, and there's not any expense to what they're giving away, except for time and volunteer services.
And
So-
utilities to keep it
utilities
at
and
Utilities,
rent.
yeah.
to
Yeah.
preserve it.
Huh?
Well, they're utilities to preserve the product.
Right.
Preserve the product, transport the product, you know, they go out and do a lot of runs to get
Picking 'em up, they
what
do.
they need and.
Yeah, and St. Vincent doesn't care for children,
No, they only care for adults.
for adults.
Correct.
So what happens to the kids?
Kids can be covered by Can Care. It's a state program.
Yeah, I know it.
And so they can be covered by that. And so I think St. Vincent Clinic, and I can't speak for them, but I think St. Vincent Clinic saw a need in that. What they were trying to cover was the divot that wasn't covered. You know, Medicaid, Medicare, if somebody has that, they can get some kind of care. If they have Can Care, they can get some kind of care. If they have insurance, they can get some kind of care. And then there's this chunk of people who
Have nothing.
have nothing. Yes. So, that's kind of where that is.
Did you find yourself scoring these on your, as an individual? Did you score these?
Did I
Yeah.
score them? Yes.
Were we close to what, are you willing to share that?
I'm not, because
No, I understand.
I'm staff. And my job is to serve you.
Okay.
And so
Impartial observer.
I just want,
I have opinions.
No, I
I
get-
just think it's best not to voice them.
It'll stay in this room.
No, it won't.
This is going out to the world.
I know, yeah, exactly, yeah. I mean, yeah.
This is an open.
I
mic.
will say that I think they are all deserving. And I think that it is a hard choice. This is probably the hardest part of this board's job, is to make choices about how we think the community needs to be served by public service dollars. So, you know, I don't mind that you take a few minutes to think about it or discuss it among yourselves. I think it's healthy to do that. And I think that some of you may think that we want to give a straight 7%. Some of you may think that we want to put more money up at the top because that obviously is where you scored the higher need. Some of you may think that neither of them are right and that we need to score them based on population served. Either way, any of the ways that we want to do it is correct. I think it's what you as a board, what you know about the community, what you as the board think that we need in our community and where the biggest need is.
Well,
I
it seems
think-
like our need, according to the scoring, is toward health rather than food or shelter.
Well,
Depends. Yeah.
that health is first, except that the guidance center is number 4. So that's kind of a health thing too. But then Catholic Charities comes in pretty close after that. So, and they do a variety of things. A big variety of things. It's hard to categorize them.
Well, and either way, it's not a game changer.
No, it's not big money,
I mean,
but
that's-
every agency counts every dollar.
yeah.
I'll just say that.
the numerical difference doesn't
Doesn't affect.
doesn't wow me to the point, I'm more inclined to go with the 7% increase based on what we've discussed just in the last few minutes. Wanting to make sure that we help everybody equally at this point.
I would support a 7%.
That's 3 on my
Across the board.
side.
I would do that. I did like what you did, you know, like Leavenworth, the interfaith, they asked exactly, you know, they're gonna get pretty much what they asked for even without the 7%, right?
Yes.
I mean, you just kept it the same, so.
Well, because it was less than the
Yes,
7%.
exactly.
So if they ask for a flat amount, then, and they're just starting because they're a new application.
Right.
They've worked with us before, but as landlord tenant, now the city is gonna take care of that component. And so, the Interfaith Community of Hope is applying as a new applicant.
Right.
To do with the funds. Basically, we provide that rent or utility assistance so that they can put the money somewhere else.
And I think that, for me, it would be okay just to leave it that one as it is, because that's exactly what they're asking for.
Right. All right, I'm
And
hearing
then share the 7% with the
3.5 or 4 for 7%. Is that where we're going? Is that fine with you, Bobby? Okay, that's what we're going to do. We're going to do the straight increase. Is there anything, and, Michelle, at this point, we're finished with the meeting. She's got someplace to go. We are? Yeah, I'm going to go ahead and just talk in general.
Do you want to adjourn the meeting then, so it's?
Okay.
We probably need to adjourn.
We adjourned the meeting. Yes, please do that.
Do I have a motion to adjourn the meeting?
I move to adjourn the meeting.
I second it.
Okay.
All in favor, say aye.
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 Adjourn the meeting.